high cholesterol and kidney disease. And that's what this video is about today. And a very high portion of people who have chronic kidney disease develop high cholesterol. So it's very common that a lot of people take statin medications to help lower their cholesterol. Now, I have chronic kidney disease for over 20 years and I never had to take a statin because of all the things that I do to prevent that, which I'll talk about in a little bit. Now, what the research shown in previous research is that with chronic kidney disease, you're at a very high rate for cardiovascular, heart disease. And one of the reasons is because the cholesterol becomes irregular. So what tends to happen in some people is that the LDL, the bad cholesterol, goes up, triglycerides go up, and then the HDL, which is nicknamed the good cholesterol, goes down. So those ratios lead you to high cholesterol and more heart disease. And so that's something that we always want to look out for and we always want to prevent when it comes to kidney issues. So some things that you can do to help support a healthy cholesterol level nutritionally is taking omega-3s. Now, I've been taking omega-3s for over 20 years, and I can tell you that it has done a lot of good things for my kidney health, and it's helped support good kidney health and support a good cholesterol level. Now, I'm not going to get into omega-3s too much here because I have other videos that break it all down on which ones you should get, which ones you should purchase, so you can go look at those on our channel. Other things that help support healthy cholesterol levels is niacinamide. It helps with the LDL levels, and that's B3, okay? And you can also look that up online. And in B3, you want to use a good dose, okay? And niacinamide is the one I prefer because it doesn't cause any flushing like niacin does. And niacin flush can be uncomfortable. It's completely harmless, but it can be uncomfortable. It can make you really red and itchy. And I've tried using niacin, straight niacin before, and I get a pretty bad flushing reaction. So I use niacinamide instead, which helps support those good cholesterol levels and help support kidney function too in a few different ways. Now, those are supplements that you can do. Now, if you want to look to do something dietarily, okay, if you have high triglycerides on your blood work, on your lab work, you can just look at it there, get a copy for yourself. It's always good to learn how to read these things to help maintain your health. And if your triglycerides are high, you can lower your carbohydrates a little bit in your diet. Depending what type of renal diet you're following, that could be a good thing for you to help lower your carbs, especially if you're maybe a diabetic renal disease. Okay, so it'll help bring your triglycerides level down. Also an apple a day. So we have a lot of research in people that don't have kidney disease of what apples will do cholesterol. So it helps lower cholesterol. Now, unfortunately, we don't have a lot of research with apples and kidney disease on cholesterol levels, but we know that apples are a great food to have if you have any type of kidney issues. So you can try an apple a day. An apple a day could possibly get your cholesterol levels in a better area in 3 to 6 months. What else you can do is a high fiber diet, because fiber is good for the kidneys, it's good for the heart, it's good for cholesterol and so many other things in your body. So you want to get a high fiber diet. You can get a high fiber diet through eating lots of kidney friendly fruits and vegetables. Whole grains will give you fiber, but watch your phosphorus levels with whole grains. So that's the whole take and give. When it comes to whole grains, if you have a high phosphorus level, you might want to limit the whole grains. If you don't have a high phosphorus level, then you can have some whole grains and get that extra fiber. And then also fiber supplements. So fiber supplements are good. It seems just about all types of fiber supplements benefit kidney disease, some better than others. So depending what you have access to, you can add in some fiber supplements. And if you're going to do fiber supplements, you have to take a powder. The pills, you're not going to get enough pills unless you're willing to swallow a lot of pills to make a difference. And for most people, it's just not realistic and it's not economical because you'll be going through bottles and bottles. So you want to get powder forms. So those are things you can do to support healthy cholesterol levels when kidney issues are present. A lot more things you can do. Check out our other videos, link, subscribe, go to our channel. Thanks for watching, everybody. This is Robert Galarowitz, naturopath, nutritionist, kidney disease survivor from HealthyKidneyInc.com. Bye, everyone.